All right, good morning, everyone. I'm Lisa Bender. I'm the president of the Minneapolis City Council. I'm going to look to the clerk to guide us through this, which is, I'll just say in plain language for folks who are watching, we had intended to adjourn to a closed session for a security and health briefing about COVID-19. We had a request to hold this meeting in public, which we are honoring. Our intention was never to to have anything in secret at all. There's a press conference coming up later this afternoon, and then public presentations on Monday and Wednesday at our committee, as I said earlier. So today's discussion from staff, from interim city coordinator Mark Ruff and our health commissioner Gretchen Musicant, will be a very brief preview of those more detailed conversations coming up on Monday and Wednesday. There is an all department head meeting at noon on this topic, so we will have to be brief because of the department heads needing to leave, but I know they're available and they will be at the press event later today. So I'll turn to the clerk for the procedural guidance about how to convene this meeting as an open meeting.
Madam President, you've convened the meeting as a public meeting. I would only note for the record that all members are present except for Councilmember Philippe Cunningham.
Thank you, Mr. Clerk. So we'll begin with a brief overview from Interim Coordinator Ruff about some of the preparations that staff have been making for internal operations, for external supports, for partnership opportunities. Again, I just want to emphasize so much that if something isn't said right now, it doesn't mean it isn't happening. Every department across the city enterprise is preparing for accommodations coming forward. We're working to support our employees in multiple ways and be there to support the members of the public. So we appreciate so much all that the department heads have been doing. They've been in frequent contact with my office and the mayor's office, and so I'll turn it over to Mr. Ruff for that overview.
Thank you, Council President, members of the committee. It's important to note that we as a city provide essential services. It's obvious, but important to emphasize some of those essential services. I want to bring a message from, for example, our Public Works Director, Robin Hutchinson. The EPA has come out and confirmed that our drinking water and our method of treating drinking water means that the water coming out of your tap is as safe as possible, and we have confidence that people can continue to utilize that water both for drinking and for cleaning. And as it's deeply connected to what the health commissioner has talked about is the best way to stay healthy is to wash hands, wash surfaces, and all of these things are connected. So that work is not only continually underway, we are also making sure that the staff at the water treatment facility has redundancy that can operate at a lower level of staffing should people fall ill. And all of that kind of planning work has not just been going on in the last few weeks, it's been going on for years, right? And so these are putting into plans in place that are very different only in the sense that probably the last major pandemic plans come from 10 years ago. And so it's updating some of that, but certainly our continuity of operation plans we've been undertaking in the last year. Okay, so the effort today, I think, is the speed at which this is unfolding and the uncertainty about how long it's going to last. And so that's part of what's different about recovery from a disaster or some storm or something like that it is an uncertain future. I think we as a staff are following closely, and we have this great benefit of a very experienced health commissioner who will address you of her advice, her continual communication with the State Department of Health and with our partners. And as recently as yesterday, I talked to both the superintendent of schools and with the county administrator about how they were approaching all of these issues. And so it is done in coordination and not in isolation. I think part of what the coaching that we are taking is that what's happening in New Rochelle, New York, or in Seattle helps inform our actions, but we shouldn't necessarily replicate exactly what those actions are because we're at a different state of this incidence. And we're also listening closely to community on their requests and their suggestions. So I'm going to give you a couple of examples of not just the preparedness that the council president mentioned this morning, but also actions that we are already undertaking. So for example, Hennepin County and the assessor's office have both determined that they can, instead of having assessors go into people's houses for this period of time, they can undertake exterior examinations of residences to determine value. So that's a way of both keeping our workforce healthy. It's a way of keeping residents healthy, and we know that the concern about who's coming into my home is going to be increased. We have even this morning, our CPED staff, our regulatory services staff, our health staff, all talking about how are we going to work through inspections in this environment, and what do we need to do to make sure that, again, we are keeping our staff as healthy as possible, with the understanding that we don't have a workforce like in a downtown office building where we can send 95% of our workforce to work remotely. I mean, we have fully a third of, if not more, of our workforce that has to be on premises or in community doing the work that you've charged them all to do, right? And so how do we adapt is where we are in, not just the preparation, but the adaptation phase. The same goes with public meetings. The mayor sent an email out. We are looking to restrict the number of public meetings, but we still want the city to function as much as it can function if this does last for a longer period of time. So it's really a challenge to all of us about how do we become creative about getting feedback, right? And so we don't have work that stops. It may delay for a period of time. It may take a different tenor, but we still want to move forward on as much as possible in doing the work of folks' business, with always the understanding that preparedness and response is on a spectrum, meaning that we are moving from one space to another, meaning that based on certain indications, certainly if the Minneapolis school district closes, if a number of school districts close, that's going to change what our response is for our workforce, right? If we get a recommendation from the Department of Health of a limit of a certain size of gathering, we will make those adjustments according to the science that is presented and the recommendations that is presented. And same with how we move out of this, right? We have to look beyond with that, always that expectation that we will gradually move out of some of these restrictions, and we shouldn't just rely on what somebody is doing in the other part of the country, but upon our experts to give us advice on when we move out of that. So that's the kind of the full view of where we are today. We will certainly be happy next week to give you more details and answer your questions about what does this mean for this department? What does this mean for this department? But I mean, this meeting at noon is a very important one for us to be able to compare the notes that's been done. So we also want to make sure that we're treating our workforce as fairly as possible. And we certainly take and welcome the staff direction from the City Council this morning, which is I'm giving you the report from what is the internal work, which is primarily my charge, right? We have a great deal of departments. I know we are have already been working with CPED, for example, on supporting small business. So what work can we be doing in the meantime? And you will be hearing from them as well. So, Madam President, I think that's enough for right now, but I'm happy to answer any brief questions before I turn it over to Gretchen.
Thank you, Mr. Ruff. Councilmember Gordon.
Thank you very much. You mentioned water supply, and I know that the Public Works Director has the authority to suspend all shutoffs. Do you know if she's made that declaration yet or not?
Madam Chair, Councilmember Gordon, I don't know if she has, but you will be receiving information about the procedures that we know we can administratively do that. I think we will want to work. There's not just the public works side of it. There is the finance side of it, and so we want to make sure that both of those folks and the communication. We want to make sure that before that happens, we have 311 fully prepared so they understand how they can respond to questions. So there are some mechanics that we need to move through, but we will make sure that people have an adequate supply of water.
And I understand that a vote from the council isn't required, and of course we're not voting on anything here, but I just want to express at least my expectation that of course we're not going to cut anybody's water supply off during the middle of all of this, and we're going to try to make sure that they can have their water and stay healthy.
Thank you, Councilmember Gordon. And I did have the chance to send that staff direction around to department heads, the key department heads this morning, and received a communication back from Director Hutchison that there was work underway on the water issue, that they did have the administrative authority to make the decision not to shut off resident and business water supply, but that they welcomed the expression of support from the City Council and the staff direction today. I will say, I think that's a great example of something we're hearing from community members who are concerned about the long-term impacts of economic economic changes. We do, of course, have paid sick time required in the city of Minneapolis. We collectively passed that policy. So if folks have any questions about their eligibility or enforcement of paid sick time, our Civil Rights Department has a website that answers all the questions and gives contact information for employees who need any answers about their right to paid sick time. We are, like I mentioned this morning, and Mr. Ruff could talk about this more, making preparations for a compassionate approach to supporting our own employees through their paid sick and vacation time, and making accommodations for different scenarios where folks may need to work from home or take time off, recognizing the different types of jobs within our city enterprise, and of course wanting to support the workers who have those jobs that require on-site work, and making sure that they are treated equally and fairly to the folks who it's easier to work from home or have a laptop or those things. Our IT department is working on accommodations. So I think we have both those short-term things, preparing our workforce, making decisions in coordination with the Minnesota Department of Health about public meetings and our own employee health. But then those longer-term economic impacts that might come, for example, from small businesses seeing less income, or from workers who are not protected with enough leave to have to start to have economic impacts, or some of those longer term things. We don't want residents to face eviction or face water shut off, or face their energy cut off. So some of those things like water, we have direct control over. Some of those are in partnership with our utilities. And I know Councilmember Gordon and Schrader are in communication with our utilities. We've done outreach to our legislative delegation and partners at the county. Our housing staff are being very proactive in addressing folks who are experiencing homelessness, who may need housing or shelter during this time. So those are more in the longer term preparations about potential economic impacts, but all of that work is happening within the different departments. So I appreciate the highlight of that one. Councilmember Goodman.
Thank you, Madam President. The Councilmember Gordon's question about water has to do with what happens to people who haven't paid their water bills, and then their water will be turned off. My question is about this ridiculous rush to Costco to buy pallets of water. And that indicates to me that people are afraid that they won't have the source of water. And I think that's my bigger concern is we don't just provide water for the city of Minneapolis, but we provide water for 20 other suburbs. And I think there needs to be some sort of statement. I've talked to the mayor about this, that the water still comes out of the river. It goes through an ultrafiltration plant. It's not a heavily staffed operation. It doesn't come into contact with people. And we're going to be providing water for all of the suburbs in the city. And you don't need to be stocking up on pallets of bottled water. Now, you might if your water's been turned off for another reason, but where it sounds like we're not going to do that either. But that's not as much my angle. My angle is this fear factor of people going to the stores and buying all of the food or all of the toilet paper. The one thing we know is that the government provides water, and it is your anticipation that we will be continuing to be doing that, correct?
Madam President, Councilmember Goodman, my understanding is that with a minimal crew, we can run fully our water operations with less than 10 people. And that's just at the Fridley and Columbia Heights plants, which are also redundant and treat water a little differently and are very effective in the way that water is delivered. So I think it's an example that one of the reasons we have customers is the quality of the water and the quality of the delivery as well.
Madam President, Mr. Ruff, and if those 10 people all got sick, there would be 10 others who are not sick who know how to operate that system, correct?
Madam President, Councilmember Goodman, that was part of the redundancy I've talked about, and that's true not just for water, it's true for our fire stations, it is true for our first responders, for our 911 callers. These are all critical services that we take very seriously.
That's the kind of main thing I want to get out, is that we're not going to have a problem with basic services like fire or water. I know there's many other issues, but we're at in a Maslow's hierarchy of problems here. I mean, people have such a fear factor that I think it is part of our job to be honest and transparent and confident where we know we can be. And on the issue of water, we can be. And I appreciate that response.
Thank you. I have a number of colleagues in queue. I do, I'm noting the time, and I want to invite Commissioner Musicant up to just maybe give a little overview about how we're working together with the State Department of Health and how, council members, city staff can expect communications to come about shifting recommendations from health experts.
Thank you, Madam Chair. So yes, there is so much to say and so little time at this particular venue. We have had incident command for a couple weeks in place, and we are expanding it as the response changes. It's of great comfort to me to have Mark Ruff in the position he's in. It's been fantastic to work with him, and I have great confidence in our partnership. We have been a very close relationship with the state and are following their lead at the State Health Department. We are also have agreed to have a multi-agency coordination approach with the county, and we are working with the other local public health departments, of course, in the metro area as well. I have had the privilege and opportunity to work at the national level as well during these last few weeks, and so I was able to be at a White House briefing and influence members of Congress in their thinking about some of the funding that will be coming our way, and we have also been supporting funding at the state level as well that will help shore up some of our response over the next few weeks and perhaps months. We've been working with safety net providers to make sure that they have continuity of operation, that they have the supplies they need, the visiting nurses, the community clinics. And we are in close communication with the work that's being done amongst the healthcare providers as well. And so we think of the supplies that we all have collectively as a pool that can help fill in gaps so that we don't have services disrupted because of the lack of supplies, even though they are in short supply. Masks are hard to replace, so we have also been working internally in the city to see how many of our workers need what kinds of masks, and also following advice about reuse of some of that equipment, and then also thinking about, I know when I was a nurse, in practice, I guess I'm still a nurse, but when you needed to go into isolation, you put all your protective equipment on, and then, oops, I forgot something, and you take it all off, and you go get that box of Kleenex, and you put a new set back on, and you go in. There's sort of a sense of abundance about protective equipment, and that is not the environment we're in right now. There are guidance for these N95 masks that are ultrafiltration and how they can be used 5 times or more. And so we are creating that guidance for our own staff in their use. And then we're also thinking about, does everybody have to use them, or can we have some folks go in, like the firefighters go in first and they're using masks, and then only when they say, yes, we do need some police help here, put a couple of masks on and come in. So we're looking at all our procedures and not just the equipment themselves, but trying to keep people safe. In looking at sort of following, we're still in Minnesota in a containment phase, meaning we can identify where cases that are people that are positive got the disease. So we can say, oh yeah, you got it from that person. And so I'm going to learn everything about you and your behavior while you were sick and who you interacted with. And then I'm going to talk to all of them. Those that aren't sick yet, I'm going to have them stay home for 14 days. The ones that are sick, we're going to make sure that they're taken care of. That is the best way that we want to try and control this. Once we find that people have gotten the disease and they don't, I don't know where, I wasn't on a trip, I didn't know who else had it, then you lean into something called community mitigation, which is where we don't want people to gather in large groups because we don't know where all those people came from that are gathering together. So there will be a press conference later today that the state is going to have, and I think they will help us understand how we might be moving into guidance, not absolutes, but guidance that would include some community mitigation. We've done a tremendous amount of consultation with folks, small arts businesses that want to call and find out how can they stay in business through this time, using some of the guidance of 6 feet of separation and 10 minutes. So maybe there's a book reading and you just spread the chairs out and everyone's 6 feet apart, or maybe you go outside. So there are lots of strategies outside of these large venues that people can use to still stay in business and keep the livelihood and well-being of our community alive. So I could talk about like 25 other things and would be happy to do that on questions, but I think my time is running short, and I'll sit for questions.
I saw Mr. Ruff stepped out with the Public Works Director, who was probably here hearing us discuss water. I did ask if there's any way, I know this meeting is extremely important and has every department head in the city. I am going to see if they can postpone it a little while so we can ask questions. I'm going to ask my colleagues, I have 5 council members in queue, to just ask your question. We'll gather them and then ask Mr. Ruff and Ms. Musicant to address them. And if there are things that cannot be accomplished now for any reason, we will gather them either for communication later today, over the weekend, or on the scheduled hearing committee meetings on Monday and Wednesday. So we have Councilmember Johnson, then Ellison, Council Vice President, then Warsami and Fletcher. Councilmember Johnson and Kano.
Thank you, Madam President. And I appreciate Councilmember Goodman talking about the hoarding issue that's going on with some supplies. I was at a Target store last night, and some constituents spotted me and they said, this is the 3rd store we've gone to try to get toilet paper, and they're out. And sure enough, you look down the aisles, they're out of toilet paper, out of sanitizer, they're out of cold medicines, which puts people who are trying to deal with non-COVID-19 illness at risk, or makes it harder for them to recover. And so what are we doing to work with the commercial and private sector to help get information out around the supply chain, around supplies, and to try to quell that kind of panic-fueled behavior that, frankly, is unnecessary and only causes, and in fact kind of reinforces itself in a way. And then have we, for instance, I know in other cities, they've worked with distilleries to start producing hand sanitizer, because that way it can get out immediately into the community. So have we looked at doing some of those things? And I know we're supposed to ask our questions, so I got a few questions as well.
Perfect.
There's also a lot of concern nationally around testing, and a lot of news articles and stories around lack of testing that's going on, where people have a lot of the different symptoms and yet they're not getting tested. And we've even seen in Seattle where some folks who haven't qualified for formal testing have tested positive through research-based testing. So I'm wondering if you can help dispel concerns around testing availability with the city's travel policies. I'm wondering where we're at with that. I believe MDH has actually restricted travel for 30 days, non-essential travel, as they get a handle on this. And so I was actually even out traveling on behalf of the city earlier this week, and so it would be helpful to know about that. And then I had one other one, but it's slipped off the top of my mind, so maybe I'll think of that and return.
Thank you, Councilor. And Ms. Musicant, so Mr. Ruff is at the meeting, which is starting now. He was hoping you could be there in about 15 minutes. Of course, you're a critical voice in that meeting with our department heads. And I know, this is really important, but also, of course, our department heads are preparing and doing all the things that we're talking about now. So I'm just going to gather all the questions. And again, we'll direct the health questions to you. We'll collect the others. I can try to answer them from the leadership meeting yesterday as well. Councilmember Ellison.
I had one question, and certainly some of the lack of toilet paper and some of the hoarding is illustrating our need for more bidets in the U.S. But anyway, so I just wanted to say I know that Mr. Ruff is coordinating with a lot of different partners, intergovernmental partners, and I know that while the council and the mayor don't have authority over evictions, I was wondering if anyone's been in touch with the county sheriff to see if we can get a commitment that they will not enforce eviction actions. I haven't had that conversation with the county sheriff, but I think and I'm happy to reach out. But also, if any of my colleagues or the mayor are interested in sending a unified message, I would be in support of that. But I also, there's a possibility that Mr. Ruff has already maybe made some contact there. So just wanted to ask that question and see what needs to be done or not on that front.
Council Vice President.
Thank you, Madam President. Ms. Musicant, I'm just hoping maybe you can define incident command for the public. I'm not sure everybody understands what that means. I know you said we've been in that mode for a couple of weeks, and so hopefully we can get some clarity about what that means. And, Mr. Ruff talked about, New Rochelle and Seattle. And nationally, this is a global epidemic. So I'm hoping we are just looking beyond just what's happening in the United States. And seemingly our response here has been rather slow. And so I'm hoping that we are taking into account what's going on in other parts of the world to inform our decision making as well.
Thank you. Councilmember Warsame.
Thank you, Madam President. My question to the Commissioner is, with regards to testing, and the fact that this is a big challenge for us, and there's been a lot of mistakes made. That aside, Minnesota is well known to have a lot of fine institutions. The Mayo Clinic is here. We have a lot of medical labs here. Has there been an effort to get them involved in terms of addressing the issue of testing, and to make sure that, we utilize all the resources that we have, not just governmental, but also private institutions as well? So that was my question.
Great, thank you. Councilmember Fletcher, then Kano.
Thank you, President Bender. If there's not an answer to this right now, that's okay. But one of the things that I love about our community when we're in a disaster response or in a situational response is its generosity. And our community partners often play important roles and often fill some of the gaps that we fail to fill in the city. So I'm wondering if we've identified a philanthropic partner. I have constituents contacting me asking, where can I send money, anticipating that there will be needs for people who are, for example, food insecure and self-quarantining. How do we arrange food delivery? Who's doing that? And let's presume they need funding. There are people willing to be generous. So let's make sure that we have a place for that generosity to land and effectively get distributed.
Thank you. Councilmember Kano.
Thank you, Madam President. I want to say that we should all be promoting the MDH hotline for COVID issues only at 651-201-3920. Once again, that's the MDH hotline for COVID-19 issues only at 651-201-3920. Specifically on the water shutoff notices, I want to make sure that we're not just doing a press conference to announce that, but that we're actually notifying people who are on that list of getting water shut off that they will not get their water shut off, that we're going above and beyond communicating via Twitter and Facebook and websites, because there's a lot of people in our city that do not have access to that. So I've been asking our department director, Robin Hutchinson, to make sure that we are reaching out to communities in a racially equitable way, which means going above and beyond the website issue. We know that there's lack of internet access right now for our communities, and I was hoping we would hear an update on what we're doing as a city to make sure that low-income residents and communities of color have free internet access that is adequate and reliable. Right now, if you pull up the map on the city of Minneapolis that provides free Wi-Fi locations, they are only in public park places where we probably don't want to send people to. So we have to resolve that matter. I had a conversation with Minneapolis Public Schools, and they are feeling confident that they can probably address some of the food insecurity issues. But what we are lacking is the ability to help workers pay for rent and basic needs who don't have access to paid sick. We have a lot of servers. We have a lot of people in the gig economy, in the cultural economy that are going to be suffering economically over the next couple of weeks because of the proactive approach to prevent the further spread of the virus, because precisely we do not have the testing to actually know who has it. So I think that our frame of mind should really be about planning for preventing the further spread instead of waiting for it to pop up and then try to mitigate it then. So on that front, I really want to encourage us to figure out how are we providing subsidies for workers who don't have access to paid sick leave? How are we providing access to free internet? How are we providing other supplemental support for employees who are not going to be able to have that economic buoyancy to get them through 2, 3, 4, 5, 6 weeks of school closures, of events being canceled, of projects being delayed or not not happening at all. So I was hoping that we would actually be having a heartier conversation about the city subsidies that we're going to have to approve to make sure that our local economy doesn't crumble under a potential massive closure of whether it's workplaces, schools. Obviously, the University of Minnesota already closed, and so once our schools do close, we're going to have a lot of families and unsupervised youth that are going to need those reliable adults around, that are going to need that extra money for food and shelter, as well as healthcare and childcare. Where are we having those conversations? Where is that happening?
Great, thank you. Are there any other questions from council members? I know we do want to let Director Musicant get to the meeting that's happening, but this is really important. So are there any other questions? I don't see any. I will say almost everything I heard mentioned is something that was addressed in our leadership meeting yesterday, and I know is underway. I think since we have Commissioner Musicant here, particularly focusing on the health-related questions makes sense. I will just mention that Mr. Ruff, I believe, is probably discussing right now at this meeting the city's travel policies relating to travel for employees. We have talked to many partners related to issues around evictions. I don't know that anyone has called the Sheriff's Department, but we should follow up after this meeting. I know that there are many, many conversations happening with our legislative delegation, particularly Representative Gomez, showing enormous leadership, folks at the county, our staff in many departments talking about things like food access, communications, creating an economic safety net for families. I think some of the ideas mentioned here from our colleagues are really amazing, and if those things are not underway, I think there are many conversations happening where those specific items could be incorporated. We did hear during this meeting from our Director of Public Works that they have exercised their authority under a statute that I don't have right in front of me to shut off. To suspend all water shutoffs for 30 days. They have that authority, and because we had discussed and taken the action in council, they felt clear on our position, so that decision has been made this morning. I think to the council member's point, it's important to communicate that. I'm sure that there's usually a notification related to water shutoffs, so we'll make sure that the staff are thinking through how they can get the word out and make sure families know that their water will stay on, and businesses as well. So I think I tried to kind of cover all the non-health things very quickly. Again, this is just such a very sliver of the things that are happening, but a really important discussion. And I just want to highlight, I just appreciate so much the City Council and all of your thoughtfulness and commitment to our community, and it shows here today and every day. So, Commissioner Musicant, there are a few things I think specific to health. One is incident command.
I made
the
a
medical institution. It's perfect. Thank you.
Thank you, Madam Chair. I wanted to pair a couple that might be unexpected together, the hoarding and the generosity. So this is a time of uncertainty. It's a changing dynamic. Everyone would prefer to have concrete, black and white, do this, don't do that. Everything's done, we're taken care of, and that's really not the way this is going to play out. Having said that, we all want to do something with our anxiety, and so some people are shopping. Those who have the wherewithal are shopping, and they're not leaving anything for the people who maybe just want to be able or can only buy one at a time. And so I think we need to appeal to people's sense of community. We will be most likely using social distancing and strategies that further isolate people. And so something that folks can do is to care for those in your sphere. Reach out, call them, find out if they've got enough cans of soup. Can you drop some off? I think there are individual efforts that we as a community can call upon and follow through on that will be helpful to others and will also help us feel like we are part of doing something. Now, missing today is Councilmember Cunningham. He's not here because he's sick. That's doing something too. That's a very important part of doing something. And sometimes we feel like I should just, soldier on. They need me, I need to be there. But really, the biggest job you can do is to not show up when you are sick. So I like the idea of a philanthropic partner. I'll look into that. We have been starting some conversations with the schools to help think about how would we continue to help them provide food and other things if they would need to suspend. And certainly that's going to be true for the elderly as well. Testing. Yes, unfortunately, we are in a position where we haven't had enough tests. I think the state is doing a good job with the resources we have in deciding how to use the tests. Hopefully, we will find that is not covering up something we don't know. Nonetheless, there is more testing already happening. The private sector is doing more testing. I just saw in the paper today, Mayo researchers are going to come up with, within a week, a new test. I think that's going to be available. Don't quote me on that. Go read the paper. That's where I got it. But yes, I think within, and again, listening to public radio while I was driving today, there is a sense that there will be more tests within a week or two. So we're going to be in a new era. But part of this is we have to act in the time that we're in as well. At the same time that we're blaming and wishing, we have to take what we've got and do the best we can. And I think that's what we are doing here in Minnesota. Incident command is a structure of proceeding in times of crisis that was created out of forest fires. And it really is a way for there to be a clear line of who's in authority, who's going to work on that project, who's going to work on that project. You have an incident commander, you have communications folks, and then you have people who are doing planning, kind of thinking forward. You have people in logistics who are figuring out how to get stuff and do stuff. You have folks in finance that are figuring out what are the financial ramifications, and you have people in operations who are like, how are we managing this thing that's going on? So incident command allows any entity to set that up, and then other entities like the county can figure out, what's the city doing? Oh, you got incident command. I can talk to your commander, or my logistics people can talk to your logistics people. So that's really all it is. It's a structure, and reports are created. There's paperwork connected to it, but it's really just a structure of decision making, so you kind of know where to go. Let's see. What other? Oh, looking to others, communicating in different ways. We have been speaking to groups. We're trying to reach out to cultural communities, thinking about ways to reach them outside of the main press. We're certainly working with the culturally specific media, but also connecting with people in a more one-on-one way. And then also looking outside of the country. I was at a meeting yesterday where someone mentioned that work in the way that they're communicating about things in New Zealand was particularly appealing, because I think here in the United States we've focused mostly on information that fits in our head, and that's really important. You know, what's the science? What are we supposed to do? What are we not supposed to do? But hoarding and some of these other issues are coming from the heart, from the anxiety, from the uncertainty. And so in New Zealand, they were doing a better job of balancing their communication and really talking to both of those levels. So we're trying to learn from that. Those are the things I picked up.
Thank you. I will note that the clerk is, Commissioner, why don't you go ahead and go to this meeting where I'm sure you are very needed. The clerk has transcribed this meeting, including the details of all of the questions. I also have more shorthand notes. So we will be able to gather all of these, as well as the questions that you've been directing at me and the staff, and continue to both communicate in real time as things evolve or change, or if there are any urgency to the questions, as well as prepare for the presentations on Monday at Peace, as well as PSEM on Wednesday of next week. As we've heard, I think from all the staff, the situation is evolving. Also, as we were sitting here, I noticed that Chair Green is working with the district court that is in charge of ultimately making decisions around eviction enforcement. And that is actually a statewide conversation that is happening thanks to community leaders who are asking us to take action on evictions. So those things are also underway with many partners. So even as we've had this brief conversation, there have been decisions made and actions in place to support our community. And I just feel really proud to be part of a city, a county, and a state that is taking this so seriously, maybe echoing the commissioner's remarks that we are preparing with facts and with health data and preparing for those, for informing people, but also we are leading with compassion and making sure that folks who need our support, that need a safety net, that need services even more now than ever before, we're working together, all of us in our community, to provide those. And I think it's really important. So thank you for all of that. Councilmember Johnson.
Thank you, Madam President. I just wanted to mention a quick update on one issue. I really appreciate Councilmember Cano bringing forward this idea around the internet, and was able to connect up with U.S. Internet, and they are working to make Wi-Fi freely available to all residents across the city. And it sounds like that will be going live at some point early next week.
Thank you. Is there anything else? Councilmember Cano.
I'm curious about sort of the cadence of this work. Like, are we expecting to receive updates once a day? Is there a weekly meeting that all the council members can go to get updates on what's happening? I don't have a sense of how sort of coherent or sustained this effort is, and I like timelines. I like predictability. I would like to better understand what the framework is for how this work is being put together, so that we can either elect to participate or just anticipate sort of updates on a regular basis. I just don't have a full understanding of how this work is evolving.
Sure. Thanks for the question, Councilmember. And I think I imagine that's part of the discussion right now with department heads. We have been seeing, frequent communication, more than once a day communication coming from different departments about specific issues. For example, the cleaning issue or some of these other particular policy areas. I think it's prudent to ask Mr. Ruff and Commissioner Musican and Barrett Lane, who's our Director of Emergency Services, to, I think, communicate to us how they will be communicating to policymakers. Of course, as today was, any communication to all council members is subject to the open meeting law. And so if we were to have a conference call or any sort of communication beyond email, that would be publicly noticed and publicly accessible per our rules. So I think for now, a lot of the communication has happened via email. Of course, the two committee meetings that are coming up next week, and I imagine likely other committee meetings regarding specific issues around housing or other items will come forward through our committees. So I think you were looking for something a little more specific and detailed, and so I think we can ask for that later today. The next thing that will happen is 1 p.m. The state is having a press conference with their updated guidelines, and then there'll be a press conference at 2 p.m. With the mayor with some of the more details about the city's preparations. Anything else? Thank you so much. Really, truly, I appreciate all of you and your leadership very much. With that, I'll take a motion to adjourn. All in favor say aye. Aye. Any opposed say no. That carries. Thank you, and we are adjourned.